I'm going to be doing this brief voiceover PowerPoint on chronic obstructive pulmonary disease, or COPD. This information has come from the Mayo Clinic, the CDC, and lung.org. COPD is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough with mucus or sputum production, and wheezing. It's typically caused by long-term exposure to irritating gases or from cigarette smoke. People with COPD are at increased risks of developing heart disease, lung cancer, and a variety of other conditions. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. These two conditions usually occur together and can vary in severity among individuals with COPD. Chronic bronchitis is inflammation of the lining of the bronchial tubes, which carry air to and from the air sacs, or the alveoli, of the lungs. It's characterized by daily cough and mucus production. Emphysema is a condition in which the alveoli at the end of the smallest passages, bronchioles, of the lungs are destroyed as a result of damaging exposure to cigarette smoke and other irritating gases and other particulate matter. Although COPD is a progressive disease that gets worse over time, COPD is treatable. With proper management, most people with COPD can achieve good symptom control and quality of life, as well as reduce the risk of other associated conditions. Patient findings. COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Signs and symptoms of COPD may include shortness of breath, especially during physical activities, wheezing, chest tightness, a chronic cough that may produce mucus that may be clear, white, yellow, or greenish, frequent respiratory infections, lack of energy, unintended weight loss in the later stages, swelling in the ankles, feet, or legs. People with COPD are also likely to experience episodes called exacerbations, during which their symptoms become worse than the usual day-to-day variation and persist for at least several days. Diagnostic methods. The most common method for diagnosing COPD is spirometry. It's also known as pulmonary function tests, or PFTs. This test measures lung function and capacity. To perform this test, the patient will exhale as forcefully as possible into a tube connected to a spirometer, a small machine. Also, chest X-ray, CAT scan, and arterial blood gases may be obtained. Pharmacologic treatments. For most people with COPD, short-acting bronchodilator inhalers are the first treatment used. Inhaled or oral steroids, combination inhalers, theophylline, which is not a steroid, it relaxes smooth muscle in the airway to allow air to flow better, and antibiotics. Non-pharmacologic treatments: oxygen therapy, pulmonary rehab programs, and smoking cessation.